Hello, good evening, everybody. I am Dr. Nitin Bote. I am an intervention cardiologist practicing in Mumbai. Mm, I am practicing in Mumbai since last 10 years and I am doing various intervention like angiography, angioplasty, and I have my own clinic, Nandini Heart and Child Care, Sion, and I am attached to Raheja Hospital, Surana Sethi Hospital, KJ Somaya Super Specialty Hospital, and Machine Heart Institute. Okay, today we are going to talk about an interesting topic. The topic is a general topic, that is how to take care of your heart. Okay, we all know that heart disease is a killer disease. It is a leading cause in our India. Every 1 in 3 death is due to heart disease, and the heart disease are so much rampant that in India almost 25,000 deaths are occurring every year because of heart disease. This figure may be more than that, but we all should know how to take care of our heart. And heart attack and stroke are generally related. Basically, they are combination of risk factors like smoking, diabetes, hypertension, lipid disorders like dyslipidemia, then obesity, and most importantly, stress factor. We all know that it is never too late to start changing your lifestyle towards healthier heart. Healthier is the heart, healthier you will be living, and longer the life. Okay, so healthy diet, what do you mean by healthy diet? A diet which should contain different portions of fruit, vegetable, whole grain, legumes, and nuts. If you follow the healthy diet, you can all possibly decrease your cholesterol and it can take care of your heart. Okay, if you want to eat non-veg, fish and boiled eggs are okay. Avoid yellow portion of the egg, and always you should avoid cookies, avoid ghee, avoid butter, avoid oily food. And if you are overweight, try to lose the weight. Obesity is defined as any patient whose BMI is more than 25, and central obesity, that is adiposity, is most common factor in India. The obesity is measured by waist hip circumference ratio. Any male with waist hip circumference ratio more than 80 centimeter, and in males more than 90 centimeter waist circumference is defined as obesity. So this is an abdominal fat which is very bad for your heart, and this abdominal fat contains VLDL, triglyceride, and LDL, which is very bad fat. You should always try to reduce the calorie contained by 500 kilocalories per day, which will help you to lose the weight approximately half to 1 kilogram per week. Then start increasing the physical activity. What do you mean by physical activity? The activity can be brisk walking, it can be swimming, it can be cycling, it can be running like jogs, and the normal recommended time for the activity is at least 150 minutes of moderate intensity activity per week. Moderate intensity means brisk walking, climbing stairs, dancing, gardening, or doing household work, which can result in mild increase in your heart rate. This activity is very important. Okay, fourth topic is avoid any form of tobacco. Tobacco is consumed in India by orally or smoking, like cigarette smoking, bidi smoking. Any form of tobacco or even the second hand exposure to the smoke is dangerous. Quitting tobacco is the biggest gift of health that you can give to yourselves. If you avoid tobacco, if you avoid smoking, it will be a biggest achievement. like you can live up to healthy life. And if you are smoking, it will increase the risk of heart attack, heart disease by 50%. Avoid use of alcohol. Moderate consumption of alcohol should be there. If you are taking heavy alcohol, avoid alcohol. Most importantly, blood pressure and sugar. If you are a diabetic patient in India, around 75% of the diabetic are having heart disease. Heart disease is very rampant in diabetes patients, and if your sugar is not controlled, then you are very prone for heart disease. Sugar should be, the HbA1c should be less than 7%. If your sugar is very high, it can lead to various problems like obesity, stroke, heart attack, unstable angina, and chest pain. You should always try to set targets for your sugar. Sugar, obesity, and hypertension, when they combine, they form a worse trilogy. If they are combined, the mortality, means the death rate, and the morbidity, means admission rate for heart disease, will increase by 50%. Smoking, alcohol should be avoided as early as possible. If you're taking any form of smoking like tobacco and cigarette smoking, this is very dangerous for your heart. Now we should know what is heart attack and what is heart disease. Heart attack means any patient who has got a chest pain which is left sided, and that pain radiates to left side. Okay, left arm, left shoulder, left jaw, and back pain. In diabetes, this chest pain may not be there. They may have breathlessness like saans phulna, and they may have giddiness. Okay, for heart disease management, if you are having acute onset chest pain, go to the nearest cardiac center and go and get your ECG done. ECG can tell you about heart disease diagnosis and heart attack. Next step is 2D echo. 2D echo means we can get to know the exact pumping, that is ejection fraction of your heart, and multiple problems like wall morphology, then wall problems, then some leaks can be find out. Then third step is stress test. Stress test means treadmill test. In this test we can get to know whether there are any silent blockages in your heart. Okay, this heart attack is very common in India, and most important factor which we have observed over the last 3 years in COVID pandemic and corona disease is lack of sleep. Any patient who is having less sleep or inadequate sleep, they are prone for heart attack. If you are not getting 8 hours of sound sleep, then your heart rate may rise up and you are prone for heart attack. And many a times this lack of sleep is an important factor for your heart disease. Then eating inadequate or maybe eating bad quality of food like junk food is also disastrous for your health. So you should always avoid eating bad cholesterol food like pizza, burger, and many other things. You should always try to take fresh fruit, legumes, nuts, and you should always have adequate quantity of water. So if you follow this healthy heart diets and tips, I'm sure that it will help you for reducing heart attack, the risk of heart attack, and there is a high chance that you may keep your heart healthy and away from heart attack. Thank you.